False about first metacarpal. The base is occupied by a condylar articular surface for trapezium. What is true about first metacarpal? Shortest and stoutest of all metacarpals, and it does not articulate with any other metacarpal bone. Rotated medially through 90 degrees with respect to other metacarpals. Fascia around nerve bundle of brachial plexus is derived from prevertebral fascia. Facial sleeve around bundle of brachial plexus is derived from prevertebral fascia. Cranial part of accessory nerve supplies levator palatini. Deep flexor of forearm are supplied by median nerve. Which muscle is inserted into the floor of the intertubercular sulcus of the humerus? Latissimus dorsi. All are true about proximal humerus attachment except supraspinatus at left tubercle. So what is true about proximal humerus attachment? Subscapularis at lesser tubercle, teres minor at greater tubercle, and infraspinatus at greater tubercle. Boundaries of upper triangular space include all except subscapularis. So boundaries of upper triangular space include teres minor, teres major, and triceps. All are contents of cubital fossa except ulnar nerve. So the contents of cubital fossa are median nerve, biceps tendon, and brachial artery. Froment sign is seen in ulnar nerve palsy. Roots involved in Erb's palsy are anterior primary rami of C5 and C6. The interossei are supplied by deep palmar arch. Which nerve originates from trunk of brachial plexus? Suprascapular nerve. Muscle with dual nerve supply is brachialis. Winging of scapula is due to which of the condition? Long thoracic nerve palsy. Following a deep cut overlying the hypothenar eminence, it is observed that the patient cannot hold a sheet of paper between the second and third digit. Which of the following nerve is most likely damaged? Deep branch of ulnar nerve is most likely damaged. Which ligament transfers weight from peripheral to axial skeleton? Coracoclavicular ligament. Froment sign is seen in which nerve palsy? Ulnar nerve palsy. All of the following are considered to be rotator cuff muscle except teres major. Supraspinatus, infraspinatus, and teres minor are rotator cuff muscles. Injury to long thoracic nerve, it can be tested by asking the patient to touch the opposite shoulder. The term Guyton's canal is in relation to which of the following? Ulnar nerve. Not present in proximal row of carpal bone is trapezium. So which are the bones of proximal row of carpal bone? Lunate, scaphoid, and pisiform. Nerve related to anatomical snuff box is superficial branch of radial nerve. Laborer's nerve is median nerve. Spinal part of accessory nerve supplies sternocleidomastoid. Biceps brachii is supplied by musculocutaneous nerve. About radial bone, true except. So major contributor to wrist joint is false. What is true about radial bone? Radial groove is present. Radial artery lies medial to styloid process of radius and medial bone of forearm. Contents of mid-palmar space are all except first lumbrical. So mid-palmar space contents are second lumbrical, FDP of third finger, and FDP of fourth finger. Which intrinsic muscle is not supplied by median nerve? Adductor pollicis brevis is not supplied by median nerve. So which is supplied by median nerve? Abductor pollicis brevis, opponens pollicis, and first lumbrical. Winging of scapula is due to paralysis of serratus anterior. Axillary nerve supplies teres minor. All arteries involved in anastomosis around scapula except infrascapular. So circumflex scapular, suprascapular, and transverse cervical are the arteries involved in anastomosis around scapula. Radial styloid process gives attachment to brachioradialis. Erb's palsy involves C5 and C6. Posterior wall of axilla is not formed by supraspinatus. It is formed by subscapularis, latissimus dorsi, and teres major. Klump's paralysis affect C8, T1. Thorax SA node is located subepicardially. Muscle of expiration is intercostal and rectus abdominis. Trachea begins at the level of lower border of cricoid. The development of septal defects in the fetal heart occurs at 5 to 8 weeks. Lung abscess secondary to aspiration is most often seen in posterior upper lobe and apical lower lobe. All generation of bronchus are fully present by 16 week of intrauterine life. Foreign body aspiration most commonly enters right main bronchus. The length of an adult trachea is 14 to 15 centimeter. An adult trachea has a diameter of 1.2 to 1.6 centimeter. Carina in an adult is at the level of T4. During quiet breathing, the lower border of the lung is found at the level of sixth rib in the mid-clavicular line. The lungs receive parasympathetic innervation from the vagus nerve, receives sympathetic innervation from preganglionic nerve cell bodies located in the intermediolateral cell column of upper thoracic spinal cord segment, and lungs are innervated by visceral afferent that utilize both the vagal and sympathetic pathways to enter the central nervous system. The left coronary artery has a branch that commonly anastomoses with right coronary in the coronary sulcus. Left coronary artery has a branch that commonly anastomoses with the branch of right coronary in the interventricular sulcus, and it is short in that soon after its origin it bifurcates into the anterior interventricular and circumflex arteries. Anterior interventricular artery is a branch of left coronary artery. At the mid axillary line, parietal pleura extends up to the level of 10th rib. The coronary sulcus is occupied by the coronary sinus. Posterior interventricular artery is a branch of the right coronary artery. The esophagus passes through the esophageal hiatus at vertebral level T10. It is found between the trachea and the thoracic duct in the superior mediastinum. It is typically ventral to the azygous vein in the lower thorax. Which of the following statements about the thoracic wall is true? The terminal branches of the typical posterior intercostal arteries anastomose with branches of the arterial intercostal arteries. The internal thoracic artery ends by dividing into superior epigastric and musculophrenic arteries. The sinus node is supplied by right coronary artery. The terminal branches of the internal mammary artery are superior epigastric and musculophrenic artery. The thoracic duct crosses from the right to the left at the level of none of the options. The correct answer is T5. The narrowest part of the alimentary canal is cricopharynx. Thoracic duct is also called Paquet's duct. The esophageal opening in diaphragm is at the level of T10. Right coronary artery supplies all except apex of heart. So right coronary artery supplies the intraventricular septum, interatrial septum and SA node. The arterial supply of the bundle of His is interventricular branch of left coronary and right coronary. Bronchopulmonary segment contains all except independent pulmonary vein. So bronchopulmonary segment contains independent pulmonary artery, tertiary bronchial and conical segment. Which of the following structures do not pierce the diaphragm? Aorta does not pierce the diaphragm. Inferior vena cava, esophagus and greater splanchnic nerve cross the diaphragm. All are true about trachea except that it bifurcates at C7 is not true, and tracheal cartilage is circular is not true. Trachea is 15 cm long and it is lined by pseudostratified columnar epithelium. The inferior vena cava opening in the diaphragm is at the level of T8. Bronchial vein of the right side opens into azygous vein. Which is true about apex of the left lung? Subclavian artery forms a groove. All the direct articulation of true rib except costosternal joint. So the direct articulation of true rib is costochondral joint, costotransverse joint and costovertebral joint. What is true about arch of aorta? That it is closely related to parietal pleura. Narrowest part of the esophagus is cricopharynx. Length of esophagus is 25 cm. The base of the heart is related to descending aorta. Which of the following about parietal pleura is correct? That it is sensitive to pain. Left coronary artery supplies all except posterior one-third of septum. So left coronary artery supplies SA node, left ventricle and apex of heart. The inferior surface of the heart is formed by right and left ventricle. The following form of the boundaries of Koch triangle except origin of left coronary arteries. So what are the boundaries of Koch triangle? Tendon of Todaro, opening of coronary sinus at the base, that is the orifice of coronary sinus, and septal cusp or leaflet of tricuspid wall, and AV node at apex. These are the boundaries of Koch triangle. Atrioventricular node is supplied by right coronary artery. Base of the heart is formed by both atria. Major contribution by left atrium and partly contribution by right atrium. Right middle lobe consists of which bronchopulmonary segment? Medial and lateral. Coronary sinus opens into right atrium. If a foreign body enters into the nose accidentally, it enters apical segment of right lower lobe. Great cardiac vein lies in anterior interventricular groove and posterior atrioventricular groove. In a cross section of thorax at T4, what is found? Arch of aorta is found at T4 in cross section. Structure arching over hilum of right lung is azygous vein. Lower border of costodiaphragmatic recess is at level of 10th rib. One of the following ribs articulate directly with sternum except 8th rib. Sensory nerve supply of trachea is internal laryngeal nerve. The most dependent part of lung in the supine position is lower apical. Bundle of His has a dual blood supply. Part of heart lying in front of esophagus is left atrium. Correct about right and left. Main bronchi is right bronchus is more vertical and broader than the left. True rib are 7th. All the following veins drain into coronary sinus except anterior cardiac vein. So which veins drain into coronary sinus? Great cardiac vein, middle cardiac vein and small cardiac vein. All open in right atrium except great cardiac vein. So what opens in right atrium? Superior vena cava, coronary sinus and inferior vena cava. True about thoracic duct, it passes through aortic opening of diaphragm and it crosses from right to left at T5 vertebrae. Which one of the following is not structure is not situated between the neck of the first rib and apex of the lung is thoracic duct. So which structure are situated between the neck of first rib and apex of lung? First posterior intercostal vein, superior intercostal artery and sympathetic trunk. All are inserted in the first rib except scalenus posterior. So which are the muscles which get inserted into the first rib? Scalenus anterior, scalenus medius and suprapleural membrane. Esophagus receives blood supply from all except internal mammary artery. So esophagus receives blood supply from inferior thyroid artery, inferior phrenic artery and bronchial artery.